Hey guys, I wanted to get on here tonight and do a video, and so my makeup's gone and I'm looking all crazy because it's almost time to for bed. And so I'm realizing that right over here, you can't really see it. I didn't realize you couldn't see it. Good thing. But there's Connor's dirty clothes in the floor, and then I realized right beside me, there's a wet diaper. So, proof that this is real life, and I definitely don't have it all together. So, anyway, I wanted to get on here tonight, and I wanted to talk to you about Connor getting tubes put in his ears, because that is the only surgery video I haven't done that I want to do. His first surgery, a lot of you that know us personally know what it was, but it's kind of a private dude matter. I'll leave it at that. And so I'm not going to get totally into that. But anyway, you can ask me if you want to know, and I'll tell you, but I'm not going to make it all public. Anyway, so Connor had ear infections back to back to back to back to back to back. I'm not joking. I don't know what the official rule is before you can get referred to a ENT, a specialist. But in our case, we were told it had to be reoccurrent 12 weeks back-to-back ear infections. And if you haven't been through that or through anything where your child's on antibiotics for that long, it's horrible. He cried all the time. He constantly had an ear infection, obviously. Literally, it was 12 weeks back-to-back. And the antibiotics, Connor, all antibiotics tear up his stomach. It was horrible. And what would happen was he was on them so long, I don't even think they were working correctly. He was like getting immune to them. And so he was having really bad diarrhea, and it got to where it didn't stink. And if you've been through that, you know exactly what I'm talking about. What happens is they're covered. Half the time you're covered. It's all the way up his back. One morning I got him out of bed, and it was all the way up in his hair. It was all the way everywhere. And of course at night, obviously he's sleeping, so I don't know. But like during the day, it would be all over him because I couldn't smell it and I didn't realize he had used the bathroom. So it was bad. We had to pick him up from school a lot, and he wasn't really sick, but it was the diarrhea. And I will say that his school, his teacher and the aides in his room, this was last year's, this was pre-K, different teacher and class than now, but they were amazing about, cleaning him up and letting him stay at school, where a lot of times we would have been out, and I could not stay out of work for 3 months. So they were really good to us, and I know they probably weren't supposed to be, probably wasn't protocol, but they kind of understood our situation, and they were really good to us. So I wanted to give them a shout out. They're amazing. Anyway, so it was a lot of ER trips. It was a lot of doctor visits. It was horrible. It was awful. He was in a lot of pain, and then a lot of discomfort from the stomach stuff, and I was constantly wondering, are we about to have a mess? It was awful. So anyway, 12 weeks of that, we finally got referred to a specialist, only we couldn't get in for like a month. And now I know it's because Dr. Belmont is who we were referred to. He's amazing, and that's why we couldn't get in for a month. Everybody wants him. And so, anyway, so we got in to the ENT. We got to a point where we were referred to an ENT, ear, nose, and throat specialist, if you don't know. And we were told, hey, I'm going to keep him on this antibiotic until you can get to the specialist, but this ear infection is not going to go away. Like, the meds aren't working anymore. It's not going to happen. So pretty much you know your child's in pain. You know that not only that, but these antibiotics are not really working. And yet we're going to keep him on antibiotics that are giving him horrible diarrhea and making him really sick. And so it was awful, y'all. We've been through a lot harder stuff now, but at the time, it was a bad storm in our life. It was really bad. So We got referred to the specialist. Finally, our appointment came, and they did hearing tests. They had to actually, Dr. Belmont had to clean out his ears. When we got there, Dr. Belmont said his ears were so impacted with wax that he could not see his eardrum. So he takes him in this room. We have to hold him down. Of course, some more people, more than just me, had to come in and hold him down. He may be, I always say this, he's tiny but mighty. And he puts up a really good fight for such a little dude. And so they held him down, and he took this big, long pick looking thing and literally dug. He had this microscope thing, and he dug in his ear. And I'm going to be honest, I hope you're not eating while watching this because it's really gross. But what he pulled out was impact wax. And it was black, like black. It was gross. And he said likely it had been in there for years. Finally got all that out. And I'm talking awful, awful. And he said, I don't even have it all out. He said, I don't think I can get it all out in office, but I can see his eardrum now, and he's definitely infected. Which, he knew that anyway, but he said, I don't want to dog anyone out or anything, but he did say that there's no way anyone saw his eardrum to diagnose a ear infection, and yet we had been told we had ear infections for 3 months prior to that. So anyway, just wanted to throw that in. So that was a shock and frustrating and made me a little angry. But anyway, so he cleaned out his ears. They did a hearing test. Of course, Connor wouldn't comply for the hearing test. He sat there like this and said, nah, to everything so he wouldn't look, and let them know if he could hear adequately and all this stuff. So anyway, so he said he definitely needs tubes. There is a ton of fluid behind his eardrums on both sides, and he said he has more than likely heard his entire life like he's underwater. And that absolutely broke my heart because the thought of that seems horrible. But he said if there's any good, and of course we didn't see any good, but if there's anything good about it, the good news is he's probably never heard like he wasn't underwater, so he doesn't know any different. That's heartbreaking and a little reassuring. It's kind of like a bittersweet thing. At least he never heard clearly and realized a difference, but it's also heartbreaking that he's always heard that way. And so he said we definitely need to put tubes in, and we were like, yes, please. If he would have said, I have some time right now, let's go get the team to put him to sleep and let's do it, I would have let him do it right there in his office. I seriously would have. I was so frustrated, so aggravated. He was so sick. And anyway, so yeah. So we scheduled the surgery. It was, of course, a few more weeks out. It's more waiting. It's you get all this bad news and stuff needs done, but it's hurry up and wait. So we had to still wait. So anyway, we went in that morning to get tubes put in his ears. He had had surgery prior to this, so it always freaks you out. As a parent, it will always freak you out. But they put him in this hospital bed, and they wheeled him away, and I was all sad, and it just looked so scary. But anyway, the good news was he was going to clean out the rest of the wax, and he was going to hear. He said he's going to hear crystal clear. He said for the first time in his life. And so we were so excited, and I remember them wheeling him back in after surgery. Surgery went good, everything went great, and he came in, he took us in this little room. He comes out and is like, Malone family, and you jump up what's wrong? And he took us in this little room, and he's like, nothing's wrong, it's over. It took 15 minutes. It might have took a little bit longer because he was cleaning out wax and doing some other stuff, but seriously, 30 minutes tops, it was over. And actually, I thought something was wrong and they weren't going to do it because Connor had such high fevers from the ear infection. I thought, oh my gosh, they've got him back there, whatever, and before they could put him to sleep, they realized he had a fever and they're not going to do it. But he has a fever because of the ear tubes, because stuff like that, because of the ear tubes. He has a fever because of the ear infection. We need the tubes because he keeps having ear infections. Like, stuff like that was our life. Like, it was something after something after something. We can't do this because of this, but this is going on because of this. Seriously, story of our life. But anyway, he's like, no, we did it. Everything's fine. You know, he's still asleep. He's starting to, stir and wake up a little. And we'll get him with you in just a few minutes, blah, blah, blah. Anyway, they bring him in after surgery, and he's so tiny, and he's in this big old hospital bed. And I remember talking to him, and it's going to make me cry. I always cry in these. I feel so bad. And so I was like, hey, baby, Mama's here. You did so good. And he gave me this look, and he was just like this bewildered look, because he could hear clearly, and it made me so happy, but it broke my heart. And I don't know if he really had always heard like he was underwater, but he had for a really long time. I know that, and possibly always, and he was just like, look at us, like, this is so crazy. And then he started clapping, and he was so happy, and he seriously acted like nothing was up. Tube surgery was like a piece of cake. And part of that too was we wanted it so bad because he was so sick for so long. And just a little side note from me, I don't feel like you should have to wait 12 whole weeks with reoccurring ear infections, especially when you're saying, we want tubes, give us tubes. But anyway, a rule's a rule, whatever. Some rules are horrible, I think, but it's just a little side rant from me. He did great. He bounced back. We had to do some eardrops, some stuff like that, but that was a piece of cake compared to what we'd just been through the last 12 weeks. And I'm going to put this in here too because it has to do with the ENT. They did, everything healed up. Everything was perfect. They did a hearing test not long later, again, to see how he was with the tubes, and of course he wouldn't comply. Actually, they take him, I'm going to tell what they do, because some people have asked me with children that are like, yep, babies or nonverbal, like, how do they know if they can hear and all this stuff. And so I didn't know either till this. So what they did was they took him in this booth, and it was a soundproof booth, and they were outside the booth, and they could talk to him through these speakers. They didn't put headphones on him or anything like that. And what it was there was a little TV on each wall, and when they would talk to him, like a cartoon character would pop up. And so it would get him to look, and then you'd know, and they'd do it like a whisper, and then they'd do it louder, and they'd see how he reacted. And so, the first time, Connor wouldn't even look. This next time, he looked a couple times, and then he would just start going like this, like, I'm over it, you're on my nerves. And we had a good laugh, but it's frustrating too. So they ended up doing wanting to do ABR on him. And of course, I wanted to make sure he heard adequately. So I'm like, yeah, let's do an ABR. It's an auditory brain response. I almost said surgery. It ain't a surgery. Procedure, test, I don't know. Anyway, ABR is what they call it. And what they do is they hook all this stuff up to him, and they can see on this machine, they play noises in each ear, and then they can see, based on how his brain waves respond on the screen, if he hears it and how he hears it. Is technology not crazy? Anyway, so he had to be put asleep again. I definitely didn't want to do that, but I needed to know if he heard adequately, and he wasn't going to comply for a typical hearing test. So they did the ABR. He heard perfectly. He did great. His hearing is spot on. And we were told he might have some mild left hearing loss, so we found out he does not. So that was awesome to hear. Tubes were in place, tubes were open, everything looked good. And so we were going back to the ENT every 3 months to have his ears cleaned out, because the impacted wax is just something he has. It's so far down in there that there's no way I could get it out with a Q-tip or anything like that. And so he said the best thing to do is just come every 3 months and have his ears cleaned out. So we were doing that for a while, probably about a year. And then, of course, he had tonsils and adenoid surgery and all that. And so when he had his tonsils and adenoid surgery by Dr. Belmont also, he had a tube put in one ear and not the other. And I don't remember which ear. I'm a horrible mom. That's awful to not remember which ear. But anyway, what happens is sometimes once you've had tubes in your ear will figure out how to drain fluid off itself. And so, again, I feel really bad that I don't remember which is which. But anyway, one of the ears, we went to the ENT one day for a follow-up appointment. He was going to have his ears cleaned out, and they were going to look at his tubes, make sure they were opened and everything. And the tubes were gone. We never saw them fall out. They weren't packed in there anywhere. He looked and looked and looked for them. They came out at some point. Anyway, so I was kind of shocked about that. I was really surprised. But anyway, his tubes were out, and his ears looked good. We had to wait and go back for another appointment. And when we went back for the other appointment, there was a little fluid on one ear. Or I guess both ears had a little fluid. Anyway, this has been a really long time ago, so I'm trying to remember. So we went back for another appointment, and one of the ears, again, I don't remember which, sorry, one of the ears had drained the fluid off on its own. So he said, this ear caught on just by having a tube in it. It figured out, hey, I'm supposed to drain this out. So that's awesome. The other ear did not. So anyway, when we had tonsils and adenoid surgery, we had a tube put in the one ear. So he has a tube in one ear. I'm a horrible mom. I don't remember which. Anyway, oopsie. Anyway. So he had a tube put in the one ear. Everything's going good. We've had no ear infections, knock on wood. And so he released us to go every 6 months instead of every 3. And Connor has so many specialists that he goes to every 3 months and trying to coordinate them, trying to get it all together, trying to get time off work, trying to make sure he don't miss too much school. We were very, very excited that we get to go to the ENT every 6 months instead of 3 months. It might seem like a crazy thing, but when you were going every 3 months, it's a major, big blessing. It's a big thing. Of course, we would keep going every 3 months if we need to, but every 6 sounds a lot better. So we're coming up on our appointment in December where we go back. Anyway, tubes in his ears were life-changing. We were told that it would probably help his speech since he heard like he was underwater. We were hopeful. They really thought it would help with speech. It has not. I haven't seen any difference, really, to be completely honest with you. He may say a few more words, I guess, but not really seen a whole lot. But that's okay. That's fine. So, yeah. Tubes were life-changing, so if you're on the fence about them or your child's going through recurrent ear infections, try to get referred to a specialist. I know that is super hard to do because it's got to be, there's so many protocols and so many things that have to, unfortunately, go down for you to be able to do that. But anyway, tubes. I totally recommend them. They're life-changing. Seriously, they were life-changing for Connor. It was insane. His personality changed. He was a way happier kid. Like, he was happy before. He was wild before. He was a good boy before. But it totally made him different. It made him happier. It made him more joyful. And it's kind of sad to realize that. He always heard like he was underwater. It's like you're always in this fog almost. And he is feeling better. It always had to be kind of painful. And so, anyway, that is amazing. That is exciting. And that is the only surgery I hadn't talked about besides the first one that I'm not going to talk about on camera. But anyway, so I wanted to fill you all in on that. And that way we're up to date. And from now on, any surgery we do, I'll give an update way sooner. So I'll have all the facts fresh on my mind. But anyway, so yeah, that's what happened. Crazy. Our life is nuts. It really is. So, but now you're up to date on his 5 surgeries he's had, or one was the ABR, so it wasn't really surgery, but he was put under for it. And so we're hopeful that since he's had stuff done from head to toe, that there won't be more surgeries in the future. I know that's very unlikely because I have a really bad feeling that we're going to have to get tubes back in both ears. But we'll see. Hopefully not. But we always want to do what's best for him. We always want to take care of him. And so, yeah, we're going to trudge forward and do the difficult things because they're what's best for him. And so that's what you do as a parent. And so anyway, thanks for watching. And again, if you have any questions or any other things you want to ask me or you want to know, I'm an open book. So just comment below and let me know. So thanks for watching.